Hi there. Well, we've finally made it to our dosing. We're going to talk today about the concepts of therapeutic monitoring and introduction to drug dosing. So here we go. I'm not going to read these to you. You can read these yourself. This will help you, though, to understand what things I expect you to be able to do on quizzes and exams. So why are we monitoring drug therapy? Well, we want to make sure that whatever we're giving the patient is both effective and not toxic, right? So anytime when I always tell students, if they've got a patient on a drug, they should be able to tell me what they're going to monitor to make sure the drug is efficacious for the patient. So if you're giving a high blood pressure medicine, you're probably going to measure their blood pressure, for example. And what are you going to measure to ensure that the drug is not toxic for the patient? So you have to know the side effects. You need to know what dose-related side effects the patient has so that you can ensure that the patient is not suffering from some kind of problem from the drug. So how do we monitor drugs? Of course, we measure expected therapeutic effect, as we talked about. We also will monitor for signs and symptoms of toxicity. We also sometimes will monitor a serum level or a blood level or some other fluid in the body to ensure that there's enough drug in that spot to have the expected effect. So what is a serum level and when do we get them? Well, obviously a level is maybe a not very good term for the concentration in whatever body fluid, in this case serum, is what we usually measure in patients. So when would we want to look at what concentration the patient has in their serum? Well, if there's not a good, reliable dose-response relationship. Remember, if we give everybody the same dose and everybody has the same response, there's no reason to measure any type of fluid levels, right? Because if we give everybody the same dose and we can expect the same response in everybody, there's no mystery here. So there's no reason to get a blood level. But if there is a lack of reliable dose-response relationship, then often we do get concentrations in the blood or whatever fluid we're interested in. There has to be a meaningful concentration response relationship. In other words, if the concentration is above a certain level and we expect to see toxicity, we should be seeing toxicity. And if it's we need to have it at a certain level to be efficacious, then we have to be able to rely on this. If this is not reliable, the concentration response relationship, there's be no point in pulling that serum concentration, because if it doesn't tell us anything, it's not useful to us. So there has to be a meaningful concentration response relationship. Usually there's a narrow therapeutic range. What we mean by that is there's a very small difference between what's effective and what's toxic. So we're shooting for a small region to ensure that the patient is safe and effective. The other thing another reason we may want to get a concentration is if that it's a really bad thing, if the patient's concentration is too low, or if the toxicity will occur. So for example, if we have a patient that has epilepsy, for example, and the only way we're going to know if that patient is efficacious is if they have a seizure, or the only reason we know they're not efficacious is if they have a seizure and they're driving their kids around. That's not okay, is it? So we wouldn't want to wait until we find that out. So we might get a blood level to make us feel like they're probably efficacious. Same thing with toxicity. If we know that the toxicity due to a drug is very bad, we certainly don't want them to have to experience it. Like tardive dyskinesias might be an example of that. Also, if there's wide interpatient variability, which, so everybody is all over the place as far as giving a certain dose and getting a certain effect, we may need to get that concentration to see if we can make sure that that patient is treated efficaciously. So, and obviously, what's the goal of obtaining serum levels? Well, we want to say that if we get a certain concentration, we know what's going on in the patient. So it's giving us some information on how well the patient is doing. All right, I'm going to stop there for now.